So the first question I wanted to ask is, when did you know you wanted to be a scientist?
I've always loved science. I mean, I think that science was in my future. I remember taking science in elementary school, and I was always intrigued. I always wanted to know more. And then that continued through middle school into high school. And when I went to get my bachelor's degree, I knew I wanted to get a bachelor's degree in biology or chemistry. I got a job at my college, which was the University of Southern Mississippi. I actually got a job in the micro lab. And I just really fell in love with touching science and actually doing research, because I could see how science could answer questions. And I'm always one to have a lot of questions. I always wanted to be able to continue that. So after I got my bachelor's degree, I actually taught high school for 1 year. I taught physics. And I thought that that was intriguing, but it gave me the perspective that people don't really learn about science. They don't really know how it applies to a job or their future. So then I wanted to go further my science career, and I got a doctorate in microbiology. And then I was able to come work with public health, and I've always worked in Mississippi. I really see how science improves the lives of people in ways that people don't really know, like just those things that keeps them safer, that keeps infrastructure going. It's just really invigorating to really find something that you love in life and be able to make a living and help other people in the process. I have been at this lab for 19 years, and I started my job supervising our laboratory response network lab for biologics. So I came in and I oversaw some of our molecular assays for response and for infectious disease surveillance. And then kind of moved up, and I became over all the clinical services. And so then I was able to learn all the clinical testing that we did. And I became the lab director in 2009. Being the director allowed me to actually go in every lab and actually learn those tests and meet the people and just really see what we were doing in our state in terms of science, and learning that we have so much knowledge here, and they're all Mississippians. Like, it's amazing to know that we have so many subject matter experts in so many different subjects. And a lot of them are here, and they're able to give answers quickly to big public health issues. I think the part that I like the most is some of the technical part. So I do get to troubleshoot assays. I get to work with our staff on bringing in new methodology. I do think I really enjoy hearing from my newer staff, like their questions, and like watching them run the tests and come up with new ideas on how to make things better. So that's exciting to see a new era of scientists come in. And it's kind of really cool to learn from them as well. I enjoy seeing science through someone else's eyes. Our strength is recruiting younger individuals right out of college, and then they come here and they learn a lot. They see science in action. I see that the tests we do are meaningful to the state of Mississippi, and I feel like we've really helped prevent issues in our states. We do clinical testing, we do direct patient care, and we do surveillance testing for patients. We do environmental testing. We test drinking water, we test powders, we test foods. We just test a lot of different things. A public health lab is really essential for every state because we do population-based testing. We are testing for things that protects everybody. It's not that we're not doing tests just for a single patient with the perspective that we'll heal that one patient. We're trying to give tests that give results that help heal populations in different groups. We test food sometimes to make sure that it's safe in Mississippi. So we do testing that's to identify like infectious diseases, but also we do a lot of safety testing and a lot of regulatory testing. And one thing about having a public health lab that does that, it's like an unbiased lab doing testing. We're not getting paid to do this testing. We're doing this testing because we want it to be the highest quality, because we're Mississippians. We want these products to be safe. We want safe drinking water. So we're doing it from the perspective that we are trying to make sure that everything is safe and that it meets these minimum requirements. We've really been going through a very exciting decade. Really with COVID, we were able to expand our next generation sequencing, which is something that I really see as the future of public health, because that testing allows you to like characterize things more. And that's what I see kind of a public health role, is to identify things that are threats and then further characterize them so we can know more about them. That way we can encourage, we can educate the public, we can educate our clinicians or our providers on what's out there. And that's, I think, what's been the most rapid rise is next generation sequencing. That's something that now we do in-house. It used to be something we had to refer out. We do it in-house, and then even as exciting as doing the testing, we do the data analysis in-house. So we have people that are able to use different kind of bioinformatic tools to look at data in different ways. We're doing complex science for the state of Mississippi, and this is science that other labs couldn't do or would only do if it was a large amount of money. Right. It would be very expensive testing to be able to do this at other facilities. So I think that the state supports public health lab in existence really is a benefit for the state as a whole. It really keeps the state prepared. It allows us, if there is a threat or if there's something unusual that happens, it gives us an in-state lab with trained people that have multiple certifications that can immediately do that testing. We don't have to refer threats out. We can manage those in-house in our state, and we'll get that cuts down on the time of the testing. But it also keeps us prepared as a state that we're ready for anything that comes our way.